A lot of people hear zinc and think immune support, cold lozenges, and maybe skin health. But one of the most interesting forms of zinc is actually designed to hang around in your stomach lining, not rush straight through your system. That form is zinc carnosine, often sold as PepZin GI, and the big mistake is thinking it works like a regular zinc pill. Today, you're going to learn what zinc carnosine actually is, how it may support the protective lining of your stomach and intestines, who might benefit from paying attention to it, and who should be careful. You'll also learn one simple thing you can do today. Check your current supplements for total zinc, because many people accidentally stack zinc from a multivitamin, an immune product, and a gut product without realizing it. And before you change supplements or medications, especially if you have ongoing digestive symptoms, talk with a qualified clinician.
Think of your digestive lining like a busy kitchen counter. Every day, acid, enzymes, food, alcohol, stress hormones, medications, and microbes all come across that surface. Your body is constantly cleaning, repairing, and protecting it. Zinc carnosine is like sending a tiny repair crew to that counter, with two tools attached together, zinc and L-carnosine. Zinc is an essential mineral. Your body needs it for hundreds of enzyme reactions, immune function, protein building, wound healing, taste, smell, and normal cell division. L-carnosine is a small compound made from two amino acids, beta-alanine and histidine. It is found mostly in muscle and brain tissue, and you also get it from animal foods like beef, poultry, and fish. Zinc carnosine is not just zinc plus carnosine tossed into the same bottle. It is a chelated complex, meaning the zinc and carnosine are bound together. That bond appears to help it stick to damaged or irritated areas of the stomach lining longer than plain zinc. In Japan, this compound is also known as poloprezinc, where it has been used as a gastric mucosal protective agent. In the United States, it is generally sold as a dietary supplement, not as a drug. So how does it work? First, it may help support the mucus layer. Your stomach is full of acid, but acid is not supposed to digest your own tissue. The mucus layer is part of the barrier that helps protect you. Zinc carnosine seems to support the health and repair of that barrier.
Second, it may help your cells handle oxidative stress. Oxidative stress is basically wear and tear from unstable molecules produced during normal metabolism, inflammation, alcohol exposure, certain medications, infection, or heavy physical stress. Zinc and carnosine both have roles in antioxidant defense, so together they may help create a calmer environment for the gut lining. Third, it may support normal tissue repair. Zinc is needed for cell growth and wound healing. That does not mean zinc carnosine magically heals ulcers or replaces medical care. It means zinc is one of the raw materials your body uses when it is maintaining and repairing tissue.
Your body does make carnosine, but it does not naturally manufacture a PepZin GI capsule. Your zinc level depends mostly on what you absorb from food, what you lose through the gut and urine, and whether your needs are higher. Your carnosine level is influenced by your diet, especially meat and fish intake, and by your body's own production. Older age, low protein intake, very restrictive diets, digestive disorders, heavy alcohol use, and certain medications can all affect zinc status or digestive resilience. Now, food first. You cannot really get zinc carnosine as a special complex from food, but you can get the building blocks. For zinc, oysters are the heavyweight champion. About 85 grams or 3 ounces can provide far more zinc than you need in a day. Beef is more realistic for many people. About 85 grams or 3 ounces of roasted beef may provide around 4 milligrams of zinc. Pumpkin seeds are a good plant option. About 28 grams or 1 ounce gives roughly 2 milligrams. Cooked oats, lentils, chickpeas, yogurt, cheese, eggs, crab, shrimp, turkey, sardines, and fortified cereals can all contribute.
For carnosine, animal foods matter most. Beef, chicken, turkey, pork, and fish contain carnosine or related compounds. Plant foods do not provide meaningful carnosine, although your body can make some if you get enough protein and the right amino acids.
For most adults, daily zinc needs are around 8 milligrams for women and 11 milligrams for men, with higher needs during pregnancy and breastfeeding. That is not a target for zinc carnosine specifically, it is your general zinc requirement. If you eat seafood, meat, dairy, eggs, beans, nuts, seeds, and whole grains regularly, food may be enough for basic zinc needs.
Supplements make more sense when there is a clear reason. Maybe your diet is low in zinc. Maybe you are mostly plant-based and eat a lot of high phytate foods. Phytates are natural compounds in grains, beans, nuts, and seeds that can bind zinc and reduce absorption. Maybe your clinician suspects low zinc status. Or maybe you are looking for targeted stomach lining support and your clinician agrees zinc carnosine is appropriate. A common zinc carnosine dose is 75 milligrams once or twice daily. Many products use 75 milligrams per capsule, often providing about 16 to 17 milligrams of elemental zinc. 2 capsules per day may bring you close to 32 to 34 milligrams of zinc before counting your multivitamin or food. The adult upper limit for zinc from all sources is commonly set at 40 milligrams per day, so stacking matters. Timing is simple. Many people take zinc carnosine with meals to reduce nausea. Some protocols use it twice daily, such as morning and evening. If it upsets your stomach, taking it with food is usually better than taking it empty. If you take antibiotics like tetracyclines or quinolones, thyroid medication, iron, calcium, magnesium, or penicillamine, spacing matters because minerals can bind medications and reduce absorption. Ask your pharmacist for timing. Absorption is helped by a balanced meal and enough protein. It may be blocked or reduced by taking it at the same time as high-dose iron, large mineral blends, or very high phytate meals. If your breakfast is oats, bran cereal, nuts, seeds, and coffee, that can still be healthy, but it may not be the best time for a zinc supplement. For quality, look for the amount of zinc carnosine and the amount of elemental zinc. Those are not the same thing. Look for third-party testing when possible, clear labeling, realistic claims, and a company that provides lot numbers and contact information. PepZin GI is a trademarked form, but there are also generic zinc L-carnosine products. A typical monthly cost might be around $15 to $35, depending on dose, brand, and testing. So who should pay closer attention? Signs that can go along with low zinc include poor wound healing, reduced taste or smell, frequent infections, hair shedding, low appetite, rough skin changes, diarrhea, or slow growth in children. These signs are not specific. They can come from many causes, so do not self-diagnose from symptoms alone. Risk groups include people with very limited diets, heavy alcohol use, digestive disorders that affect absorption, bariatric surgery history, chronic diarrhea, kidney disease, older adults with low intake, pregnant or breastfeeding people, and strict vegans or vegetarians who rely heavily on unsoaked grains and legumes. Here is a quick self-check. Over the last week, did you eat zinc-rich foods at least 4 days? Did you eat enough protein daily? Are you taking a multivitamin, immune supplement, or gut supplement that already contains zinc? Do you have ongoing digestive symptoms like black stools, vomiting, unexplained weight loss, trouble swallowing, severe pain, or anemia? If yes to the red flags, skip the supplement experiment and seek medical care.
Labs to discuss with your doctor include serum or plasma zinc, but know its limits. Zinc levels can change with time of day, inflammation, infection, and recent meals. Your clinician may also consider copper, ceruloplasmin, a complete blood count, ferritin or iron studies, inflammatory markers, and tests for digestive causes if symptoms point that way. If ulcers, reflux, gastritis, or H. pylori are concerns, proper testing matters. Imagine 3 people. First, the budget eater. You eat mostly cereal, pasta, rice, and occasional chicken. Your best move is not an expensive supplement first. Add 28 grams or 1 ounce of pumpkin seeds a few days per week. Use eggs or yogurt when you can. Choose beans plus a protein source, and include canned sardines, tuna, or lean ground beef if those fit your diet.
Second, the vegan. You can meet zinc needs, but you need strategy.
Use lentils, chickpeas, tofu, tempeh, pumpkin seeds, hemp seeds, oats, nuts, and fortified foods. Soaking, sprouting, fermenting, and using sourdough can reduce phytates and improve mineral availability. A low-dose zinc supplement may make sense, but watch total intake and consider copper balance if supplementing long-term. Third, someone with a health condition. If you have inflammatory bowel disease, chronic kidney disease, liver disease, an ulcer history, ongoing reflux, or you use NSAIDs like ibuprofen often, do not treat zinc carnosine like a harmless candy. It may be useful in some digestive support plans, but your situation needs medical guidance, especially if you take prescription medications.
Now let's reality check the evidence. The strongest case for zinc carnosine is not that it cures digestive disease. The stronger, more practical claim is that it may support the integrity and repair of the gastrointestinal lining. Human studies have looked at stomach discomfort, gastric ulcers, H. pylori treatment support, medication-related gut irritation, oral mucositis, and intestinal permeability. Some trials are small, some are older. Some combine zinc carnosine with other therapies, which makes it hard to know exactly how much benefit came from zinc carnosine alone. One randomized controlled study in people with stomach ulcers used around 150 milligrams per day for 8 weeks and compared it with placebo and another mucosal protective drug. Another clinical trial reported on nearly 300 people with gastric discomfort over 8 weeks. There were also studies where zinc carnosine was added to H. pylori treatment regimens, but that does not mean it kills H. pylori by itself or replaces antibiotics when antibiotics are needed.
For everyday translation, I would call the evidence promising but not universal. Stronger for stomach lining support than for broad claims like fixes gut health. Mixed for specific conditions because study designs vary. Early for many trendy uses, like leaky gut claims in otherwise healthy people. What do we still not know? We do not know the perfect dose for every person. We do not know who responds best. We do not have enough long-term data for people taking it continuously for years. And we do not know whether people with normal zinc intake benefit as much as people with low intake or higher digestive stress. Safety matters. The most likely side effects are mild nausea, stomach upset, metallic taste, or changes in bowel habits. Less common are headache or dizziness. More concerning, especially with higher doses or long-term use, is copper deficiency. Too much zinc can interfere with copper absorption, and copper deficiency can contribute to anemia, low white blood cells, numbness, tingling, or neurologic problems.
Medication interactions that matter include tetracycline and quinolone antibiotics, penicillamine, and possibly timing issues with iron, calcium, magnesium, and thyroid medication. Thiazide diuretics may increase zinc losses in urine. If you are on chemotherapy, immunosuppressants, or complex prescription regimens, do not add zinc without asking your care team. Pregnant and breastfeeding people should be especially careful with total zinc intake. Older adults should watch for stacking supplements and copper imbalance. People with kidney disease should ask their clinician before using mineral supplements. Children should not use adult-dose zinc carnosine unless a pediatric clinician recommends it. Stop and seek help if you develop hives, swelling, trouble breathing, severe vomiting, severe abdominal pain, black or bloody stools, chest pain, fainting, unexplained weight loss, trouble swallowing, or symptoms that keep getting worse. Supplements are not a substitute for evaluating serious digestive symptoms. Now, 3 myths. Myth 1, zinc carnosine is just regular zinc with a fancy label. Not quite. The carnosine complex changes how it behaves in the gut. Myth 2, if a little zinc is good, more zinc is better. Wrong. Too much zinc can backfire, especially by lowering copper. Myth 3, zinc carnosine heals ulcers on its own. No, it may support the lining, but ulcers need proper diagnosis and treatment.
Here is the big picture. Zinc carnosine is a specialized zinc compound designed to support the protective lining of your stomach and digestive tract. It is not a miracle cure, and it is not the same as a standard zinc tablet. Food should still be your foundation, especially zinc-rich proteins, seafood, dairy, eggs, legumes, oats, nuts, and seeds. If you supplement, pay attention to elemental zinc. total daily zinc, medication timing, and long-term copper balance. Your action today is simple. Take out every supplement you use and add up the zinc on the labels. Include your multivitamin, immune products, lozenges, and gut formulas. If the total is getting close to 40 milligrams per day before food, that is a conversation worth having with your clinician. Have you tried Zinc Carnosine, or are you considering it for general stomach lining support? Share your experiences in the comments and let us know what supplement you would like to learn about next.